Welcome back to Emma's Diary. My name's Louise and here are some more myths about pregnancy we can help you with. Should I only be sleeping on my side? Although it's safe to sleep on your back during the first trimester, it is a good idea to get used to sleeping on your side. This is because as the uterus gets heavier, it presses on the vein that returns blood from your lower body to your heart when you lie on your back. If you do this for an extended period, there is a risk that it could affect the flow of blood and nutrients to the placenta. If you do wake up and find yourself on your back, don't panic. It shouldn't have any serious adverse effects on your baby. Try placing cushions between your thighs, along your back and under your bump to make the sleeping position more comfortable. Will a sunbed make me feel better? There's evidence to suggest that it's not a good idea to use a sunbed whether you're pregnant or not. During pregnancy, women often find that their skin is more sensitive, which means they're more likely to burn if they're using a sunbed. A change in hormone levels means that you can also be more susceptible to the skin pigmentation chloasma that causes dark patches of skin to appear on the face. These can be made worse if you sunbathe or use a sunbed. There's no clear evidence about the effect of UV rays from sunbeds on an unborn baby. However, a link has been made between UV rays and folic acid deficiency. This is because UV rays can break down folic acid, a vitamin that's very important for your baby's neural system development in the first 3 months of pregnancy. Surely horse riding is a bad idea, right? Some women choose to continue horse riding during their pregnancy, although they're usually experienced riders and not only know the risks involved, but are used to the feel and have built up pelvic muscle strength to deal with the motion. A pregnant woman who horse rides regularly should be monitored closely for any signs of the placenta separating from the uterus, a condition known as placental abruption, which can result in miscarriage or premature labour. Another serious concern is about falling or being thrown, and it's certainly wise for all riders, experienced or otherwise, to avoid the riskier, more physical forms of riding, such as jumping. There's also the risk of being kicked in the stomach, which is more likely if you're unfamiliar with the horse. If you do have a history of miscarriages, it's best to avoid horse riding throughout your pregnancy. Can I use fake tan? Skin can be more sensitive during pregnancy, so it's best to avoid fake tan as it can sometimes cause an allergic reaction. If you do decide to have a tan, carry out a patch test on your skin beforehand. Fake tan is a non-toxic substance and doesn't go beyond the outer layer of your skin, so it's not absorbed into the body. Will over-the-counter medicines harm my baby? Most medicines can have an effect on your baby in the womb. A lot depends on the type of medicine and the stage of pregnancy that you've reached when you take it. It's really important to consult your GP, midwife or pharmacist before taking any over-the-counter medicines. So take good care of yourself and your bump, and we'll see you soon on Emma's Diary.